Welcome to tonight's webinar on gut permeability. So for those of you who don't know me, I'm Kyla Williams and I'm a clinical nutritionist. So I see a lot of clients with these kind of gut issues, and there's quite a few of you that have signed up to this webinar today. So I'm guessing it's quite a common issue as well for your clients as well. So today I'm going to be trying to go through as much practical advice as possible so I can give you a bit of help in supporting your clients a bit further. So as I go through, if you've got any questions on a specific slide, feel free to ask. Otherwise, I'll leave a little bit of the time towards the end so we can go through any other questions. So just to go through an overview of what I'll be talking about tonight. First of all, are the different terms used. So whether it's gut permeability, leaky gut, or several others. Also, I'll go through some of the symptoms relating to gut permeability, which can be quite varied. I'll go through some of the causes of gut permeability, so relating to dietary factors, inflammation, and much more. And then after I've gone through all this background and the science, and I'll go step by step through how to actually diagnose a leaky gut, and then some of the nutritional protocols for how to actually heal the gut, including diet, supplements, and a few diagnostic tests as well. So firstly, I must clear up the controversy which exists with the term leaky gut syndrome, which a lot of complementary therapists will use, including nutrition practitioners. However, it's caused a lot of medical practitioners to dismiss this as a condition, often describing it as a medical mystery or proposed condition, not really understanding what we may mean, which is a bit of a shame, really. So a lot of nutrition practitioners are explaining to their clients they have a leaky gut or leaky gut syndrome, and then they may go to their doctors, to their GP, and they really don't have a clue what they're talking about. So gastroenterologists, for example, may use the long-winded term gastrointestinal hyperpermeability, so a very long way of saying that you have a leaky gut, basically. So I think basically different practitioners are trying to explain the same thing but using different terms, so it does get a little bit confusing sometimes. But as the layman's term, it's much easier to explain to your clients leaky gut rather than some of the long terms. But if you're explaining anything to their GP, you may want to mention they have a permeable gut associated with inflammation. So this is generally what we're trying to say. So what is gut permeability? Basically, gut permeability is when the single layer of mucosal cells covering the whole of the digestive tract are damaged. So there's lots of inflammation occurring. So this is represented by these red cells here on the right hand side of the diagram, and this causes gaps to appear between the cells, and that can allow food particles and toxins to get through from the bowel straight into the bloodstream. So not the ideal situation. In a healthy digestive tract, the cells are very close together. They're effectively plumped up, therefore carefully controlling the flow of any nutrients and blocking out any particles, food molecules that haven't been digested properly. And then they have these tight junctions between the cells. So these are the normal tight junctions which hold the cells together. Also, the villi at the top of these cells help with the absorption. So this is important to have in a healthy digestive tract. So the ideal situation, this is what we want with our clients. Going back to the unhealthy permeable gut lining, with all the inflammation that's going on, there's a lot of damage that occurs. The villi are flatter. This can lead to malabsorption, nutrient deficiencies, and of course you're going to get all the molecules, the undigested food proteins passing through these gaps. And unfortunately then the body reacts to this by an immune reaction as a food intolerance. So this can then cause more inflammation. It's kind of a vicious circle. There's lots of inflammation, causes a reaction, and that causes more damage. In severe cases, it goes on and on. This can cause ulcers, but otherwise, just a permeable gut will just allow a certain amount of food and reaction to take place. The symptoms can vary. Someone may have this very mildly, someone may have it, the ulcer case, for example. So it's a very difficult to diagnose health issue. So it's often undiagnosed, but it's very, very common. And it's not really something that occurs overnight or heals overnight. It's something that develops over a long time. It's actually quite difficult to heal, but it is possible. So thankfully there are things we can do. So I've just put a few points down here to highlight some of the key roles of the gut, just to show how a leaky gut may impact other health factors, we're having a knock-on effect. So it's not just gut-related symptoms, there's lots of other things that can happen as a result of having a leaky gut. So the first thing is nutritional deficiencies. If someone isn't absorbing their nutrients very well, this may cause the gut to then have a reduced production of bile, digestive enzymes, for example, and again, this can result in further digestive problems with less digestion taking place. So that's another knock-on effect, making digestion even worse. Also, the immune function is an important relation to gut health. We always forget that a lot of the immune system is actually in the gut, almost about 70%. So a permeable gut lining is going to have a huge effect on immune function, and it's been linked to many autoimmune conditions such as rheumatoid arthritis. So if someone has a leaky gut, this is going to have an effect on immune function. So anything related to immune may be impacted as well. Also regulation of hormones. So it's not great if someone has diarrhea, have constipation, irregular bowel movements are going to affect the reabsorption of hormones in the gut. It's going to impact the adrenal glands. So this could lead to fatigue, stress, for example. Also, very important for the gut is to protect against any intolerances. I've already mentioned a little bit already. And this can occur if any of the food proteins are getting through into the bloodstream, so if there are gaps between the cells. Another important factor of the gut is vitamin B12 absorption, which is often forgotten about, but it's very, very important. If someone has an inflamed stomach, for example, if they have gastritis, the intrinsic factor production may be quite low, so the intrinsic factor is really required for the absorption of vitamin B12. So if someone has a leaky gut or an inflamed stomach of any kind, and if the production is reduced, they may become deficient in B12. This could lead to anemia and again more fatigue. So fatigue keeps on coming up, hormone imbalances keeps on coming up, and they're very, very commonly linked to leaky gut. So here's a list of some of the obvious digestive related symptoms that you kind of expect to have your clients coming to you with. Clients may not actually come to you with a digestive issue as their main goal. They may come to see you, and they often do it to me as well, saying their goal is fatigue, for example, or they have achy joints, and that will be their one thing that they really want to concentrate on. If you then start giving them advice on how to improve their digestion, they may not be too happy if that's not really their main concern, even if they happen to have IBS type symptoms. But because there's such a close link with these conditions, it's very important to explain the link to your clients so they understand that they're improving their digestion for their fatigue, to help them improve their energy, and for other conditions, whatever they may come to see you with. But here's just a list of all the IBS type symptoms that they are very likely to have. So diarrhea and constipation being probably the most common with anyone that has any kind of health issues. They're very prominent. With leaky gut, the burning sensation in the stomach and pain after drinking alcohol or spicy food are probably the most key symptoms, really, that indicate someone has a leaky gut, but all the others as well, including the gas, stomach cramps, but they can overlap with lots of other issues as well. But generally, the kind of pain and burning sensation is a good one to see. So they were the obvious kind of digestive symptoms. These are the others which may not seem as obvious at first, but they're mostly linked to the body having some kind of immune reaction and intolerance to the foods. So hormone imbalances, this may lead to mood swings, headaches. This could be high toxin levels, skin breakouts. If someone has acne, again, that could be hormone related, or any kind of infections that are going on, and immune. Adrenal glands can affect fatigue and B12 vitamin deficiency I was talking about as well. Inflammation, there's always so much inflammation going on, lots of autoimmune conditions as well, often linked. So all these kind of conditions, and depression, anxiety, so a lot of mood related disorders. There's a very strong gut brain link as well, so it can often present itself as depression or anxiety. So it's important to note that leaky gut isn't just digestive symptoms. There's lots and lots of others there as well. So these are some health issues that actually increase gut permeability. So rather than gut permeability causing another condition, these are actually linked to higher amounts of gut permeability. So inflammatory bowel diseases, it's always difficult to know the cause of these, but if someone does have ulcerative colitis or Crohn's disease, there's obviously going to be a lot of inflammation there, maybe bacterial infections, there's an autoimmune reaction as well. But the treatment protocols I'll go through in a bit are going to be very similar for these kind of clients as well. So it doesn't really matter what the cause or whether it's from a condition that's increasing it. Celiac, not there. Someone's just asking a question. Celiac should be there. Yeah, that's one of those conditions that would definitely increase the amount of gut permeability. So with celiac disease, the villi are very, very damaged, so almost completely flattened. I couldn't really list everything here, but yeah, celiac is a good one to put in. So yeah, if someone's celiac and they're having gluten, that's going to completely cut off all their villi and reduce absorption and cause a lot of inflammation. So yeah, lots. Other autoimmune diseases as well. Gastritis is one that could be either caused by bacteria, it could be something else completely different, it could be stress related, and that can either link to gut permeability or the other way around as well. HIV and AIDS, there's going to be some immune suppression as well, malabsorption issues. Same with type 1 diabetes, it's associated with gut permeability as well. So there are quite a lot of conditions going through. So the causes of a leaky gut, it's very difficult to pinpoint one or two causes because there are so many. So I'll go through these a little bit more detail in the next few slides, but this is just to see a list of everything in one place. So a lot of the causes may be linked to inflammation in some way. There's always inflammation linked in with permeable gut lining, nutritional deficiencies, particularly fatty acid deficiencies as well, because that's going to have such an impact on inflammation. Improper digestion, so if the food molecules aren't actually being broken down properly, then there's much higher chance of that actually passing through to the blood as well. High intake of aggravating foods, so whether it's gluten or something else, whatever it is. Stress. Other possible causes may be infections as well, so it's not always related to nutritional factors that you can actually control. So if someone's very healthy, has a great diet and seems to have very low stress levels, doesn't mean they're not going to have a leaky gut. If they have a parasite infection, it can cause a lot of inflammation, a lot of damage as well. So it could be either. So the role of inflammation in a permeable gut. So inflammation is a natural response of your body to try to help heal either an injury or fight off an infection, and a small amount of inflammation is fine. However, chronic inflammation is going to cause a continuous breakdown of tissues and without the healing process there, so it's just going to cause more and more damage and lead to more inflammation as well. So this kind of reaction, if it's chronic inflammation, is going to cause damage to mucosal cells. It's going to loosen those tight junctions which usually hold the cells together. And this could be a result of a medication, it could be diet. For example, if it's an inflammatory diet, that would be something very high in omega-6 arachidonic acid, say from grain-fed meats and vegetable oils. And if it was anti-inflammatory, it'd have more of the omega-3. So if someone has quite an inflammatory diet, that could be one of the causes as well. And also that's going to exacerbate the pain if there's inflammation, and say someone had an infection already and then they have an inflammatory diet, that's going to really exacerbate it and cause more sensitivity to food. So really a vicious circle there, and it's really just going to stall the healing process. So if someone has a lot of inflammation long term, it's almost impossible to heal a leaky gut if there's just so much there. So you really need to calm this down. You don't want constant high levels of inflammation. So nutritional deficiencies. This is an important one, as nutrients obviously have an importance in the actual integrity of cells. So for example, zinc is very important for cell growth and replication. Antioxidants are going to help to protect against oxidative damage. Protein, again, for the cell integrity. Fatty acids, the cell membrane fluidity. So all of these are going to help work together, and there's many others of course as well, but these are just some of the key ones that I've picked out. Just to really make sure that the cells are actually healthy in the first place. So if someone has deficiencies, of course, the cells are going to shrivel up and be very unhealthy. And that's going to have an effect, again, on how their cells can actually absorb nutrients through the gut as well. So fatty acid deficiencies, this one keeps on coming up, but it is one of the very important nutritional deficiencies that can really have an impact, especially due to the fact that it helps to control inflammatory levels. So a low intake of omega-3, if someone has low levels of omega-3 in their body, i.e. the omega-3 index, this reduces fluidity of the cell membranes, which reduces flow of nutrients, can cause other deficiencies as well. The cells become smaller, so they effectively shrink, so less plumped up. This again can cause possible gaps between the mucosal cells. And again, having a low level of omega-3 in your diet can imbalance the omega-3 to omega-6 ratio. So it's all about omega-3 plumping up the cells, keeping inflammation low. But if someone's deficient, which is quite common, then it's something to look for. So a general improper digestion. So if someone has fairly bad digestion, if they have indigestion, if they have low levels of stomach acid, for example, they're not going to be very good at breaking down their proteins. They have low production of bile. This is going to be very difficult for them to break down their fats, and of course the enzymes as well to really break down the food particles even smaller. If someone's lacking all of these, whatever the reason, if it's from nutritional deficiencies or something else, that's going to cause more problems. So we've got improper digestion, results in undigested food particles, and then if someone has a leaky gut or if there's inflammation, this may pass through the leaky gut between the cells, and this can then cause possible intolerances if there's an immune type reaction. Not ideal. So the next thing on my list of factors which may worsen symptoms are certain aggravating foods. So I'm sure you're all very aware of gluten as probably one of the most aggravating foods for anyone with leaky gut type symptoms. And this is because of the gliadine protein, which is very difficult to digest. A lot of people have reactions to it, and it's something we eat very regularly as well. So a lot of people have so much gluten in their diet that it actually ends up being something they become intolerant to. Also other foods that are quite commonly coming up as intolerant, so dairy, for example. The other foods, peanuts and pulses, put those in there because of the lectins. So lectins again cause a lot of aggravation on the gut lining. So if someone's having a lot of these foods, I would generally recommend to reduce them, or at least soak the foods that you're reducing this amount, make sure they're cooked as well properly. And then foods such as spicy food as well. Okay for most people, but I'll go through that a little bit in another slide as well. And it's usually an intolerance to these foods that develops, which is why someone has a reaction, lots of inflammation. But it's always a different food, different people, depending on what they eat. So a little bit more about gluten. I'm sure you all know where gluten is found. So protein found in wheat, barley and rye. It is, some people are also worried about having oats. So it's not strictly in oats. The gliadine protein is not strictly in oats, but it can be cross-contaminated. So often if the grains are grown nearby, for example, or packaged together, they can be contaminated with gluten. It's a different type of protein that some people react to, but mostly it's strictly gluten that people would strictly react to properly. So yeah, very difficult to process in the body. A lot of people react to this. Symptoms will often be digestive cramps, lots of bloating as well. But it's not always the cause for everyone. So although gluten will aggravate a leaky gut, it doesn't necessarily mean it's a cause for everybody. Some people can eat small amounts, they're absolutely fine. Others can tolerate it slightly more, but it really does depend on the person. But I would just say if any one of your clients are having cereal or toast for breakfast, if they're having a sandwich for lunch, and then having pizza for dinner, that's going to be far too much gluten for anyone really. And I'm sure we're always telling people to reduce this in their diets. But definitely if someone's having a lot of gluten, I always try to suggest that they reduce it slightly. So the next is spicy food. So although chilies are very, very healthy foods for most people, anti-inflammatory, beaming with antioxidants, they do have a very aggravating compound in called capsaicin. This directly irritates mucosal cells. So this is anywhere from the lips, the tongue, the mouth, and all the way through the digestive tract. So I'm sure you've tried spicy food and realize how hot it can sometimes be. If you have a really, really hot curry, it can really aggravate your mouth. If you imagine someone that has a very unhealthy, damaged gut lining, that effect is going to happen all the way through. So there's going to be a lot of blood rushing to the area, a lot of inflammation, and that's going to cause more issues. And basically the body's way of usually dealing with this is to flush it out as quickly as possible. So that will usually result in diarrhea. So if someone has a leaky gut, and they eat a lot of spicy food, firstly, they may get a burning sensation in the stomach, or if they have in the small intestines, they may have damage there. They may feel that burning sensation higher up. And then usually a bout of diarrhea as well. So if someone says they can't eat curry, they usually have the runs the next day, then maybe think could possibly be a leaky gut issue there. But if someone's healthy and it has no issues, then I say it's absolutely fine to have. So there are a few other foods as well which may also aggravate a leaky gut. So again, these foods are extremely healthy and fine for most people. They're normally very anti-inflammatory, but they do have compounds in which are quite aggravating if someone's quite sensitive already. So ginger in particular is always recommended for anyone with inflammatory conditions. It's brilliant for reducing inflammation, but the direct effect on a broken skin in the gut is irritating. So the compound in ginger is called gingerol, and this is actually related to catechin, so very similar to chili. That's why you have an almost spicy effect from ginger, if it's raw ginger. If it's in tea, it's not so strong. If it's heated, for example, if it's raw ginger, it's going to be pretty aggravating, and that's when people often complain with the burning sensation, and that's another key indicator to suggest that someone may have issues. A couple of other foods: raw garlic, raw onions, anything really that's really strong and pungent that you can imagine if you had in your mouth would have an effect. Say if you had a cut in your mouth and it would hurt, then that would hurt in a leaky gut as well, so that would cause a lot of inflammation. So you want to try and note if your clients have any sensitivities to these foods to kind of understand if they might have leaky gut. So stress and leaky gut. So it's not all about food, it's also a little bit about stress as well. So of course stress can have a massive impact on acid production. So a small amount of stress may even reduce stomach acid production. Very high amounts of stress can increase it quite high, so it can go either way, but it usually in severe cases ends up being gastritis, so again the inflammation of the stomach, and ulcers if it gets really bad. So that's why you get a lot of people that when they're very, very stressed end up going to the doctors and find out they have ulcers, and that can have an effect all the way through the digestive system as well. Also production of digestive enzymes. So when you're very stressed, digesting food is not really the body's #1 priority, so it'll often reduce the production of digestive enzymes. The digestive system gets a little bit lazy, and it's very difficult to break down food quite as well if you're stressed, so your body's thinking about other things to do. Also during stress, lots of vitamins and minerals are used up in processes, so the requirements for vitamins and minerals are actually much higher as well. So if you imagine someone being stressed, using up these vitamins and minerals, probably not eating great if they are stressed anyway, and it's going to cause a knock-on effect, and that can then increase damage to mucosal cells if they've got a higher cortisol production as a result. So next is pathogens. So these are any kind of infections. It could be yeast infections such as candida. So that's if someone's getting a lot of athlete's foot, thrush, for example, they're very likely to have a candida infection. Also bacterial infections. So if someone has bacterial infections, it may have come up in a test, for example, then that can also cause a lot of aggravation and inflammation to the gut. And of course you want as much of the beneficial bacteria there as possible, but of course people still do get infections. There's lots of antibiotics being used, so it's quite common. And then parasites, I couldn't resist putting this little guy in. So this is a hookworm, very funny little face. There's lots of other parasites as well, but these cause a lot of havoc on the body, lots and lots of inflammation. They can lead to nutritional deficiencies as well, and just generally cause lots of problems. So if someone has any of these types of infections, this can lead to a leaky gut as well, so it could actually be the cause. So next we have alcohol. So I've got a nice glass of red wine here, just to show that, of course, the odd little bit of wine is absolutely fine for most people, and it's not necessarily going to cause leaky gut if you're having small amounts. But if someone's drinking quite a lot, this could cause a lot of inflammation, and this could eventually lead to a leaky gut. If somebody already has a leaky gut, alcohol is very irritating, and again this can lead to diarrhea if someone's even just having a few drinks. So I always say if anyone has pain when they drink alcohol, if they have diarrhea after drinking, again this could be a sign that they may have some issues with the gut lining. And to anyone who does have a leaky gut, it can even just be a few units of alcohol that can actually cause an issue and can be quite aggravating. but your clients will probably know. They'll probably say if they have issues. It's very difficult to reduce this, of course, but at least if they mention they have issues after drinking, then you can see it as a sign that something's going on. So next is medication. So there's a lot of well-known irritants of the bowel lining for medication. So there's aspirin, non-steroidal anti-inflammatory drugs such as ibuprofen as well. So these are anti-inflammatory drugs, but in the long term cause a lot of damage directly to the gut lining, which then causes more inflammation. And it just can be a particular area of the bowel. And this, if someone's taking on the odd occasion for a headache, that's usually absolutely fine. But if someone's taking them daily, if they're taking it quite a lot regularly, that's when they increase their risk of developing ulcers and a permeable gut. So ideally, you don't want someone these long term if they do have an issue. So antibiotics is another one. So they of course will wipe out all the beneficial bacteria as well as the pathogenic. So this can sometimes result in infections after treatment. So of course the antibiotics will then, I'm just seeing something else. Does that include HRT? HRT does also, yes, have an effect on gut lining, not as strong, I don't believe, as the birth control pill, and it's usually quite a few years you have to be on it. So with the birth control pill, if someone's on, say, 5 to 10 years, that's usually when you start seeing symptoms of gut issues, and it's usually going to affect the pH as well, so that can affect how well you're actually breaking down foods. So any kind of hormone treatments, it's going to affect that slightly, but it's not going to be a massive issue if someone's taking it for a couple of years. It's usually after quite a long time. Got another question coming through, I think. No, hasn't come through. So back to antibiotics. Yeah, they're going to wipe out an infection if someone has an issue, but then they're more likely to have an infection quickly after, unless they dose up on their probiotics. Someone's asked, what about bioidentical hormones? Can you just explain what you mean exactly? How many years? It's usually around 5 years of someone taking birth control pill. Well, there's a few more questions coming in, but they haven't quite come through yet, so I'll go through this maybe at the end. Okay, thanks. Yeah, good. As in not synthetic. I'll have to look into that really, different types of hormones, but generally it's going to have an effect on pH of the stomach and digestibility. That's usually the way it works. But yeah, we'll discuss that in a bit. So next is how to diagnose a leaky gut. So I've gone through all the possible causes and some of the symptoms as well. So a lot of it you can do on symptom basis. So if a client comes to see you and they're presenting a lot of these symptoms, especially the kind of pain, the bloating, the diarrhea, it's very, very likely they're going to have some kind of permeable gut lining. It doesn't mean necessarily they're going to have a severe case. It could just be mild, but there's something going on, and probably lots of inflammation as well. Other symptoms, so don't forget the non-digestive related symptoms. So it could be allergies, skin issues, migraines, headaches, or the joint pains, and again the chronic fatigue. So fatigue is really, really common with leaky gut. Any kind of fatigue, tiredness, but consider all of the symptoms, not just the digestion. So diagnosing a leaky gut with tests. So if someone would like to know quite quickly and they can afford a test, a digestive stool analysis is very useful. So you can first of all test for any of the infections that I discussed earlier, but importantly you can test for secretory IgA. So this is an antibody used by the immune system to fight off infections, which is actually released from the mucosal lining. So if someone tests for IgA and the level's quite high, this suggests that there's lots of immune reactions, a lot of inflammation in mucosal cells specifically, so you know that there is an issue with the gut lining. So it is quite a useful one if someone really wants to know whether they actually have an issue with the gut lining or whether you're just going on the symptoms. Also, intolerance tests are quite useful. So if there's lots of IgG antibodies produced, whatever the foods are, if there's lots produced, it's very, very likely that someone has a leaky gut as well. Got another question. Would this show up parasite? Yeah, so I mean there's lots of different types of digestive stool analyses. Some of them just test for bacterial imbalances, others test for parasites. If you do a comprehensive digestive stool analysis, it will measure the different types of yeast, parasites, bacteria, the resistance to certain supplements, to medication, the beneficial bacteria, so come up with a lot. So yeah, you can find out about the parasites as well. So this is the protocol. I've got a few steps to follow, which I would recommend if you believe that someone does have a leaky gut. So step one, I would always recommend is to eliminate any irritating foods. There's no point trying to go in and put lots of healthy supplements in there if they're still eating lots of irritating foods. I've got another question. Which lab do you use? Do you know the Diagnostics I usually use? They do a really, really good digestive stool analysis. That's a great company. Okay, back to eliminating irritating foods. So gluten being one of the most common aggravators, I would always say for anyone with a leaky gut, really try to reduce your gluten. If someone's done an intolerance test and they're definitely reacting, then maybe cut it out completely if they're okay doing that. With any kind of intolerances, I always say eliminate these foods temporarily. So if someone has an intolerance, this is of course very different to an allergy. This is something that can come and go. It's only a temporary thing. So it means their immune system's decided to react for the meantime, but not forever. So if someone's eating a lot of a food, they usually develop an intolerance because it's coming through so much. But if they eliminate it for a few months, sometimes it can be 4 months, 5 months, 6 months, then usually their body will forget to react to that food basically, and you can concentrate on then healing the gut as well. When you take out these foods, you're reducing the inflammation because there's less of a immune reaction. So yeah, simply cutting out these foods is not going to address the cause. So a lot of people will self-diagnose and they'll find an intolerance test. They'll see they're intolerant to a very unusual food. They'll cut it out and assume that everything's going to be fine, but that's not really how it works. Of course, that's not necessarily the cause. It may just be a slight aggravator. So it's just a way to know how to reduce the immune reactions and to reduce the inflammation. And then once the gut is properly healed, so maybe up to 6 months, for example, then you go back. So I've got another question. Which food intolerance test do you use? Again, I use the Genova diagnostic test for intolerances. So they're really good. They measure, I think it's about 120 different foods for intolerance, and it will tell you the actual range of how big the reaction is. So you can actually see whether they're just mildly intolerant, so the immune system just slightly reacting, or if it's quite a severe reaction as well. I've got another question coming through. CNS is Cambridge, and it's good. Oh, yes. Thanks for that, Sophie. So back to eliminating foods. So yeah, once the gut is healed properly, intolerances generally disappear. So I normally try to give it 6 months. And then people can try and slowly reintroduce those foods. So if it's gluten, I wouldn't recommend reintroducing too quickly, but if it's a food that's quite healthy, then there's no harm reintroducing as well. So the other irritating foods to eliminate, so not only the foods that are commonly aggravating like gluten or the intolerances, there's the other foods like the spicy food, the alcohol. Spicy food, it's quite easy to get a client to reduce spicy food out of their diet. It's not a difficult one to do. So if it's just a few months, you can say try to stay away from spicy food. If there's something mildly spicy, it's normally not going to cause too much aggravation. But if it's very spicy, if they're putting chilies in their food, it's not ideal. So for a few months, I would say for them to try and abstain from having spicy food. Again, with alcohol, it's going to cause a lot of inflammation. So it's always a difficult one to reduce alcohol with clients, of course. But I always say to my clients, if you want to drink once a week, that's fine, but it's going to take a much longer time to heal your gut. If someone can completely cut out alcohol for even 2-3 months, it's very quick, the healing process. If someone's drinking 1 night a week, it's going to take them a little bit further back and make it much more difficult. But I understand that you've got to be realistic as well. So if someone wants to drink, just explain it may take 6 months to heal the gut instead of 2 or 3 months. And that's the difference usually. So step 2. So this is to test and eliminate any of the pathogens. So now you've got rid of all the aggravating foods. It's really important. I've got another question. The GI effects, yes, that's the one I use, the GI effects test from Genova. So this, the other test they have was, it's just their kind of standard Genova test. The GI effects is measures DNA strands of parasites, and it's a really, really good test to do. So yeah, that is the best, top of the range really. Okay, so back to the pathogens. So I would say, of course, most important thing is to actually identify pathogens. You can't really just guess, it's quite difficult. So if a client's happy to do a digestive stool analysis, it's really, really useful. They may wish to do the dietary options first. So it's absolutely fine if someone wants to try everything else first if they can't afford it. For example, they are quite expensive. And then if they have no improvement, then maybe you could do the test. A lot of clients just want to know, basically, want to know what's wrong and what the cause is so they can actually tackle the problem rather than just trying to do the guesswork. So ideally, have a digestive stool analysis so you can actually find out what the problem is. It may be a bacterial infection, it could be yeast, and if it's parasite as well, that's going to be completely different. Of course, if there's bacterial and yeast, if it's a mild infection, you may be able to help with probiotics. There's also a few nice supplements like oregano oil and garlic supplements, which can help to kill off certain bacteria. So garlic, of course, earlier I mentioned as very aggravating. You can buy supplements which concentrate the garlic, which are less aggravating on the gut. But even if there's a slight irritation, if this is going to kill off the actual cause, then I would say go ahead and add in some garlic supplements. If someone's cause is stress and nutrition deficiencies, then you may not want to go down that route. But if you know there's a bacterial infection, that's the cause. The most important thing is getting the bacteria out. If it's parasite, how do you treat it? I think that's the next slide. So back to bacteria. Again, supporting the immune function, so all the kind of zinc-rich foods, antioxidants, fermented foods like kefir, reducing sugar in the diet, all of these things are going to help with the actual infections as well. So worth doing a viral screen? Yes, possibly. I'm not aware of many tests that have that. The digestive stool analysis I have doesn't. But yes, I mean, test as much as you possibly can. Infecto labs. Okay, interesting. Thank you for that. So if there is a bacterial infection, and if something such as H. pylori comes up, so this is a bacterial infection which is very common in the stomach, this often requires medical attention from a doctor. So it's very, very difficult, almost impossible really to get rid of with nutrition. So they may need quite strong antibiotics to get rid of this infection. And if not, it's almost impossible basically to get rid of it. So if there are some infections that someone will need to have medical attention for. And then once they have got rid of this infection, then you can help them with the gut healing protocol. So next is parasites. So if someone has a parasite infection, this usually takes a little bit longer to get rid of. So it really depends. Parasites are so different. They all vary so much. It can take around 6 months to get rid of a lot of parasites. Golden seal is a really good one, a really good supplement to help kill off some parasites. Oregano oil again. Probiotics are always good to have just to keep up the levels of the beneficial bacteria to push out anything. But if you do the digestive stool analysis that we were talking about, the Genova Diagnostics one, they actually give recommendations on the test, depending on the infection and depending on the resistance from that infection, which supplements will work best. So for example, it may come up in the results that that particular parasite is resistant to oregano oil, but golden seal would work really well. So the test is really useful for actually knowing how you can target to get that parasite. So I usually do it on the test results. Again, support liver detoxification. So I would never recommend anyone to do a very strict detox diet or anything like that. If they have a leaky gut, that's going to cause more problems than good. But I always say support the liver detoxification. So ensure they've got lots of healthy brassica vegetables, lots of antioxidants as well, just to make sure that all the toxins that are released when there's a kill off of any parasites, is going to be able to support this as well, and it's not going to cause too much of the horrible effects. And of course, again, some stubborn parasites may require medical attention, so never try to only rely on nutrition with certain parasites. If it's a very serious infection, you may need to refer someone to a GP or a specialist, and then when they come back to you, then you can help them actually heal the gut afterwards. But it's really important to know the actual source and the infection of what's going on. So once you have got rid of all the infections, you've got taken out all the irritating foods, step 3 is to feed your cells. So this is really to help in the healing process. So for the actual mucosal cells, their main food source is glutamine, and glucosamine a little bit, but glutamine mostly. So this helps the cells to replenish them, and it really helps to improve the lining of the gut. So this is an amino acid that's basically the most important thing to have feed the cells. And you can buy this in powder form, and there's some supplements that combine this with others as well. But having the powder form is great to maximize exposure to your cells. So if you're having this regularly throughout the day, it's going to increase how much the cells have access to. So a few times a day on an empty stomach is absolutely ideal to have. So I'd always say, as soon as you find out how much, 500 grams. Yes, I think that's a very good dose. It's usually, is it? Can't quite remember the exact dose. I'm getting another question through. But it usually comes in powder form, and it's usually about a tablespoon. But a very good one to have to help to heal the gut. I got another question? No, bit of a lag. Okay, so once you have lots of glutamine in, step 4 is really to control the inflammation. So whether the inflammation was a cause or whether someone has an inflammatory condition, in order to promote this healing and to reduce the pain, you want to keep the inflammation low. So firstly, to control inflammation, consider lots of anti-inflammatory foods. So you have lots of vegetables, oily fish containing the omega-3 EPA, fatty acids, and anything rich in antioxidants. These can all help reduce inflammation. And generally limit the intake of inflammatory foods. These are the grain-fed meats and vegetable oils, anything containing omega-6. Well, omega-6 arachidonic acid for the meats, and then vegetable oils would be AL as well. Linoleic acid, that's the one. And also refined carbohydrates, so sugar, white flour, anything else that's going to increase inflammation. So try and get as many anti-inflammatory foods in as possible, take out as many anti-inflammatory foods, and that's going to be a start in helping to control the inflammation. Another way to do it is, of course, through supplements. So if you really want the powerful effects of supplements, the most anti-inflammatory is going to be omega-3 EPA, and this is really going to help to soothe the gut lining. It's going to promote the healing as well. So about 1,000 milligrams omega-3 is enough to have a therapeutic effect, and the ratio of omega-6 arachidonic acid to omega-3 EPA needs to be balanced. So that's why you need quite a lot. We have so much omega-6 in our diet, so to be able to balance this with enough omega-3 is going to help to balance this ratio out. Oh, thank you for the answer. 5 to 40 grams of glutamine. So back to the balance of omega-3 and omega-6 fatty acids. So it really helped to bring down this inflammation. So yeah, 1,000 milligrams of EPA is really the dose you need. And there's lots of just standard fish oils that will say 1,000 milligrams omega-3. However, the actual active ingredient EPA is often only about 180 milligrams. So it's usually 18% of a capsule. Just for a standard fish oil is EPA. But you want 1,000 milligrams of the active ingredient EPA. So these are the products I'd recommend to control inflammation. They're specifically designed to help control inflammation, as they are very, very concentrated EPA supplements. So Permeable step 1 is 90% concentration of omega-3, so that's opposed to 18 for just for a normal fish oil, so it's much, much higher. And so that gives you the 1,000 milligrams of EPA a day, which is the known therapeutic dose if someone has high inflammation, to bring it down. So that's really where you want to start. If a client has been on step 1 for a few months and they've brought their inflammation down, then you can move them on to step 2. So step 2 is 80% concentration. So that gives you a really good maintenance dose. So 640 milligrams of EPA. And there's a little bit of GLA in there as well. So this is the omega-6 from evening primrose oil. That's a really nice addition, as it has the antioxidants called triterpenes in there as well. So it's a really good one to have long term, just to keep the inflammation at a good level. I'm just getting a few questions through. So someone else is saying 2.5 milligrams is therapeutic to decrease inflammation. Are you talking about EPA here? What topic are we on? And do you mean 2.5 grams rather than milligrams, perhaps? I'll go back to that question. So yeah, the therapeutic dose, if someone's saying it's 2.5 grams of omega-3, that's usually because only 18% of that would be EPA. So if someone says, to do the math a little bit easier, if it's 2 grams, that would be just over 300 milligrams. So yeah, so you need to check that. And just looking at this as well. So yeah, 2 to 5 grams is often recommended for a few months. But again, a lot of these studies are recommending a few grams of normal fish oil, whereas this is concentrated EPA. So it's difficult to do the comparison without looking at the exact dose. I always compare the active ingredients rather than the amount of fish oil. So studies will, some of them will use concentrated oil, some of them won't. But yeah, the studies looking at actual therapeutic effect is 1,000 milligrams of the active ingredient EPA. So always just look on the back of the box, look at the EPA level. It gets really confusing if you actually look at the omega-3 or omega-6 amounts, but the active ingredient is most important. I usually say 3 to 6 months to start off with a high dose EPA, just to make sure that the levels are balanced and you're getting as much of the anti-inflammatory effects as possible. And then after this, you can start bringing in step 2 and this is really a maintenance dose. Step 2 also has a few added vitamins and minerals. So there's vitamin B5 in there, which is quite nice to support brain health. Vitamin D as well, so that's going to support immune function, which is of course very important if someone has a leaky gut. There's vitamin E in both of them as well to protect the oils from going rancid. So it's good having an antioxidant protection in there as well. And 2 capsules a day is usually a good dose. Step 2, you can take more if you want. You can take up to 4 capsules. So that's enough to actually bring down inflammation. So if you have any vegetarian clients, of course it's going to be very difficult to give them high dose fish oil, high dose EPA if they're not having any fish at all. So there are a few options. A lot of vegetarians will often have linseed oil, algae, hemp seed as well. Ideally you want as much of the omega-3 EPA or the precursors to EPA as possible. So linseed, for example, is high in ALA, which then needs to be converted down to SDA, so that's stearidonic acid, and then to EPA. So because there's quite a lot of conversions, lots of enzymes requiring vitamins and minerals, this is very difficult to actually process the body. So if you can have a supplement which is high in SDA, so this is echinacea seed oil, which is high in SDA, stearidonic acid, this is then converted directly to EPA. So you don't have to worry about that initial conversion, which is quite difficult. I'm just seeing here as well, chia seed is good as well. Yeah, chia seed's good as in it's very high in omega-3, but it's also high in ALA, so that's alpha linoleic acid. So that then has to be converted to stearidonic acid in the body. So chia seeds and linseeds are very, very similar in terms of their fatty acid composition. It's usually about 5 to 8% of this is usually converted to EPA in the body. So you have to eat quite large amounts compared to fish to actually get the anti-inflammatory effect. So it's not going to be a therapeutic effect if someone's having linseeds or if someone's having chia seeds, for example. Echinacea seeds, this is why I recommend, as it's high in stearidonic acid, a lot more is converted down. So it's usually around 25 to 30% of stearidonic acid is converted to EPA in the body. So much, much more is going to be converted. It's still not as effective, of course, as having EPA straight away from fish in the body, but it's the next best thing. So next is controlling inflammation with other substances as well. So we've gone through the fatty acids, which are really the most important. Controlling the inflammation is going to have the most significant effect. There's a few other nice little additions that really help us soothe the gut as well. So we have aloe vera, very soothing, anti-inflammatory as well, and it's going to help to support this healing. Licorice is another great one as well. So it's particularly good for mucus irritations. It's going to support the immune function. And deglycerized as well is the form that's going to have less aggravation, and it's going to be much softer on the digestive system. So some people do react to just chewing on a licorice stick. It doesn't taste great either, so much nicer to have in supplement form. Just seeing another question come through. If you grate some fresh ginger and pour some boiled water on it and let it soak for 10 minutes and drink it, will that be good to help reduce the inflammation? For very mild cases, it may be okay for someone to have ginger in this effect, but if someone has quite severe leaky gut type symptoms, this would still aggravate. Even drinks like ginger beer can actually have quite a burning sensation, so it does depend on the person. But I would say, give it a try. You can see if your clients can tolerate it, but I would certainly say in severe cases try and stay away from it as much as possible. Even teas as well can aggravate some people, but it depends how sensitive they are. And if someone has ulcers, for example, if they have ulcerative colitis, then I would say absolutely no ginger at all, really, until they start feeling their guts healing, and then you can slowly introduce it, and then it's going to help be anti-inflammatory, which is really nice. So back to some of the herbs as well. There's slippery elm, which is a really, really nice one as well. Has mucus-like properties, and also marshmallow root. So a lot of these sound like sweets, the licorice, marshmallow, but it's the herbs, it's the extracts. You can get lots of supplements that contain these ingredients together. There's some good ones with aloe vera, licorice, and glutamine. So if you can get all of them together, then that's ideal. And then your clients won't have to worry about taking lots of different things separately. So to control the inflammation, firstly, I would say fatty acids, definitely get that in first, as much of the EPA as possible, or the echinacea seed oil if they're vegetarian. And then on top of that, go for the anti-inflammatory herbs, ideally combined with the glutamine to help to feed the cells to heal. So they're really the key supplements for actually healing the gut. Do you recommend to have those from the beginning? Usually, yes, I do. So even though the protocol's step 1, step 2, 3, 4, you certainly can start adding these in the beginning if you want to speed things up. If someone's on a tight budget, they may want to spend a month cutting out the foods and concentrating solely on diet and having lots of anti-inflammatory foods, lots of fish, and then bringing the supplements later. It depends how you practice as well. A lot of clients I find often do quite well if they concentrate on diet first. They're actually making a conscious difference to their diet, and then if they have already booked a follow-up, or if they're planning to, then you can say you can concentrate on their supplement plan afterwards. If someone just wants to heal their gut as quickly as possible, then yes, definitely you can start everything all at once. That's absolutely fine, especially the fatty acids to bring down the inflammation. So it depends how you practice, but you can do it either way. So you can do it step by step, or you can do that straight away. And of course, it's going to be quite different. If someone has a parasite, for example, there's not too much point having lots of aloe vera if you're putting in lots of oregano oil, which is quite harsh, and you're putting that in to try and get rid of the parasites. So for those kind of issues, I'd usually recommend starting with these anti-inflammatory herbs maybe halfway through the protocol. So after you have done all the steps, you've got all the herbs in, you've reduced the inflammation, it may be, say, anywhere between 2 to 6 months if someone's very, very well behaved, if they're not having any alcohol, they're having all the right foods, anti-inflammatory foods with all the right herbs and fatty acids, and it could be as quick as 2 months. It can take up to 6 months, especially if someone has a parasite infection, for example. But after all this, it's always good to give long-term digestive support. So whether your clients, whether it's their last consultation or whether they're coming back and they want more advice, I always try and give out just some of the general digestive support. So some of the obvious factors like chew food properly. Obviously, everybody always forgets this one. If someone's not chewing their food properly, there's a lot more work for the bile, the digestive enzymes to actually do to break down this food. So if it's starting in the mouth, you're going to be reducing the amylase or the nice enzymes to break down the carbohydrates, and this is going to help make it much easier for the digestion further down the line. So another thing, eat lots of protein, omega-3 fatty acids. So again, the integrity of the cells depend on these. It's very important. Limit intake of gluten. So I'd recommend this for almost everyone, to be honest. Gluten in small amounts is fine for some people, but so many people are having reactions, and especially if they have a permeable gut lining, I would generally recommend that they limit it and find healthy alternatives. Of course, managing stress, it's a very easy one to say to someone, but if you can actually give some practical tips to someone and help them with their lifestyle, it's always good to help manage their stress. They're going to reduce their cortisol levels and help promote the gut healing, or just keeping the gut healed and keeping inflammation low as well. And then supplements to include, if someone is having regular IBS type symptoms, I'd always say have probiotics on a regular basis. If someone has indigestion, if they're burping quite a lot, then I'd recommend digestive enzymes as well. So with digestive enzymes, this doesn't have to be a permanent thing. It could just be for a couple of months, just to kickstart the pancreas to start producing the enzymes. And then someone could take it, just say with very large meals, for example, if they feel they're going to get indigestion if they're having too much. But these are kind of just general digestive tips I would really recommend to give out once you have healed the gut. So when everything's all good, then you can give out this advice as well. So they're just a few references, and these are my contact details. So you've got my email address here if you want to contact me for anything, and I can see some questions coming in already. Just having, what time do you recommend to take digestive enzymes? So usually at the beginning of a meal. So it will literally within the first mouthful. And the larger the meal, the more of the need to have them. So I can see a very long question here. It has been, I saw a new client last night who'd been bitten many times by insects as a child and had massive abscesses as a child, adult. Who had 10 serious infections and had suffered from CFS since the age of 14. Could it be a parasite? Yes, of course it could be. Yeah, I would definitely recommend the comprehensive digestive stool. Yeah, something like that. It could be, yeah, it could definitely be a parasite. It could be lots of different types of infections. It's one of the easiest ways to find out is to do a full comprehensive digestive stool analysis to really find out what's going on. As you never really know, and with GPs, they obviously have limited resources to these kind of tests, and they have often quite basic tests, unless it's private and they're gonna be a bit more thorough. But if someone quite serious and they want to understand what's going on, then yeah, definitely I'd recommend the digestive stool analysis. So are there any more questions at all? As I've been talking quite a lot. Don't think there's any more questions coming through. All good? Thank you all for listening as well. I hope you've learned something today. All right, good night everyone. Bye.